The goal of PRP therapy, or platelet rich plasma therapy, is the same as prolotherapy, and that is to stimulate the immune system to heal itself. Prolotherapy actually uses a dextrose solution to achieve this, while PRP therapy uses the patient's own blood. In this scene, the patient's blood is being drawn from her left arm. About 60 milliliters of blood are drawn for this procedure. Now, we must separate the red blood cells from the plasma from a thin layer of platelet-rich plasma, which is what will be injected back into the patient. For this process, we use a centrifuge, the most important piece of equipment when it comes to PRP therapy. Deb's steady hands fill the centrifuge with the freshly drawn blood. The centrifuge will then spin and separate the red blood cells, plasma, and the platelet-rich plasma in just about a minute. As the centrifuge begins to reach the end of its cycle, you can see the layers begin to form inside of it, with the plasma and the red blood cells. If we skip ahead in the cycle, you can see the plasma and the red blood cells drain out, leaving behind the concentrated platelet-rich plasma. Deb will now draw the platelet-rich plasma from the centrifuge and cap it off. It is now ready to be injected back into the patient's areas of pain. Platelets are small cells in the blood that help form clots to stop bleeding. Platelet-rich plasma is a patient's own concentrated platelets. PRP contains a large number of growth factors. These growth factors stimulate healing. The patient is now being prepared for the PRP injection. In this case, the injection will take place on her right hip, where her pain is concentrated. Dr. Charles Landry now marks the place where the needle will need to be inserted so that the platelet-rich plasma can be injected into the patient's hip. For an injection such as this one, Dr. Landry must use the C-arm to get an accurate X-ray image of where the needle must go. With the point of injection marked, Dr. Landry can begin to insert the needle into the patient's hip. The needle provides a direct route for the platelet-rich plasma to be injected into the problem area. As such, Dr. Landry can watch the needle's progress on the screen of the C-arm. The patient's hip is now ready for the PRP injection. Dr. Landry slowly injects the platelet-rich plasma into the patient's hip. Your physician may recommend a single injection or a series of injections based on the injury being treated. In this case, one injection was all that was recommended for this patient. The platelet-rich plasma contains 3 to 5 times the concentration of growth factors compared to normal human blood, and these growth factors go to work right away. With the procedure over, the patient is immediately able to get up and walk. You may experience mild pain and irritation of the area for several days following the injection. Some doctors may ask patients to limit motion or weight-bearing activity immediately following the injection. 3 to 7 days after the injection, you may gradually return to normal physical activities.